preventing the spread of the coronavirus in Arizona.
If someone has a fever, shortness of breath, cough, sneezing, they need to stay home.
And shielding the community from economic setbacks.
We're going to do everything we can to continue to salvage this peak season.
Plus, Tucson Police offer people struggling with addiction a chance at treatment instead of jail.
Each person that goes is potentially another life being saved.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thanks for joining us. Stepped up precautions to prevent the spread of the coronavirus define the week. From the World Health Organization declaring it a global pandemic to the U.S. announcing travel restrictions from Europe, Arizona also declared a state of emergency as it confirmed several more cases in a matter of days. We learned more about the precautions health officials in Pima County recommend from Chief Medical Officer Francisco Garcia. Where is personal responsibility in this? I mean, we hear so much about if you're sick, stay home, don't shake hands. How long is this going to continue for, and what's our role in tamping this down?
I really think that is where we really have an opportunity here. And as we lean into this next phase of the response, really what the health department is saying and what Pima County is saying is that we each need to put our own oxygen masks on first before we put it on our seatmates, to borrow an analogy from the airline industry. So what does that look like? Well, that looks like making sure that we're staying home if we're sick. Culturally, that may be a big shift depending on the profession, but we need to figure out how to make that happen because it's clear that when folks are symptomatic and they're sneezing and coughing and around other folks, that's when infection is going to occur. This virus is spread by droplets that we produce when we sneeze and we cough, and they touch the person in front of us. So that we need to make sure that that's not happening. So if someone has a fever, shortness of breath, cough, sneezing, they need to stay home, and they need to stay home until they're asymptomatic.
If someone does have those symptoms, do they call the CDC? Do they go to their primary? What about these tests that we understand are not easy to get?
So no, the short answer, right? So you do what you would have done 2 months ago. So 2 months ago, if I would have had a bad cold, I would have stayed home for a couple of days. I probably wouldn't have called my doctor. I probably would have taken some Tylenol if I was having a headache or if I was having fever, and I would have stayed home. That's what we need to do. Most of these cases, 80% of these cases are really mild, so mild that they may even be subclinical, that they may not even pop up. And so those cases need to run their course, but they need to run their course not in the workplace, they need to run their course in our homes, right? So that's if you're sick, you're not going to take that opportunity to go to the movie theater. You're not going to take that opportunity to go to a crowded area. You're not going to go to a party if you're sick. Those are the kinds of personal responsibility things that I think are really, really key. Keeping ourselves healthy and keeping our families healthy.
It seems like the cases then, if you do have those symptoms, are not as serious. Are we overreacting then?
So overreaction is a loaded word. So I think that we need to put this in the context of what influenza does to our communities every year. The big difference here, and I think we're seeing magnitudes of death that are probably, when all is said and done, it's going to be like a very bad influenza season. However, there's the big wild card is we just don't know. This is a new virus. And I think that's what's causing anxiety. And I think that's what's causing misinformation. And you see that sometimes the federal government contradicting itself. And so I think that it's really important for us not to panic and for us to listen to trusted sources of information to make sure that that's where we're getting our best advice.
The CDC announced it would provide $11 million to the state of Arizona to help combat this virus. You're a physician. How do you think that kind of money is best spent given what we know now?
So I think that testing capacity is definitely something that we have suffered from, right? So up until late last week, there was only the capacity to test about 300 people total in the entire state. About. That has improved significantly with new national laboratories coming on board and making testing available. So that's improving tremendously. But we need more lab capacity, and I think that that's one of the big things that we need to be thinking about. I think as we plan for a sustained response, and I believe that we're in this for a few months, as we plan for a sustained response, there are real economic impacts to the things that are going on right now. When conferences get canceled, hotel rooms are vacant, people get sent home from their jobs, and I think that's a really, really important piece. And so I think some of it needs to sort of think about or address some of those concerns.
You mentioned this is a novel virus. This is something that's new to us. Every year, the flu kills tens of thousands of people throughout the world. Why is this one so different?
It's different because it's different because we haven't seen it before. The influenza and are things that we are comfortable with because they pop into our human ecosystem periodically, right? This is not something that we've seen before, and I think that that's where the source of panic is coming from. This virus is not that different. In fact, in some ways, for instance, in some ways it may be a tiny bit less scary. So for instance, I think that all the data is seeming to indicate that children are not particularly vulnerable. And so that makes schools really safe places, by and large, for children to congregate, because we know that the cases that have occurred in children have been from parental and household contacts. So I think that there are things that we still don't know about that, and that's what's making everybody's hair on fire.
More than a public health emergency, the COVID-19 outbreak has financial implications throughout the world and here at home. For a better understanding of what that'll mean in the days and weeks ahead, we got insight from George Hammond, an economist with the University of Arizona Eller College of Management.
Well, you want to keep in mind that there's a huge amount of uncertainty about how the spread of the virus will affect economic activity. And that uncertainty is part of what's driving the issues that we're now seeing in stock prices with, we're in the midst of a major sell-off in stock prices. Stock prices are falling very rapidly. And that reflects, in part, the uncertainty about what's going to happen, and also it reflects some pretty calm judgments about the big impacts that we'll be seeing in the travel and tourism sector and in part across the manufacturing sectors as people engage in more social distancing or being less interested in gathering in large groups. We're seeing canceling of a lot of events around the nation. We'll probably see more in coming weeks. So that affects stocks, and stocks matter for consumer spending. So as stock prices fall, consumers will tend to spend less, other things the same.
Specifically related to Arizona, you mentioned manufacturing, I think, of the cross-border trade. What's the relationship going to be like moving forward?
Yes, cross-border trade does matter for Arizona. As we think about the parts of the world that are most affected by the virus so far, that's China and Europe, particularly Italy. Arizona last year exported about $1 billion worth of goods to China, but that's half of the value of our exports to Canada. And our exports to Mexico were 8 times as large as our exports to China. So Mexico and Canada are much more important trading partners.
Could this send us into a recession?
Yes, what's happening now does have the potential to send us into a recession. Most economists that I'm talking to these days put the odds of a recession at 50%, maybe even a bit higher than 50%. That would be a kind of a moderate downturn starting during the April to June period, so next quarter, probably lasting for a quarter or two. One of the reasons that economists are looking at that is because the spread of the virus and our reaction to the virus is going to have a big impact on the travel and tourism sectors. Leisure and hospitality, which is hotels, motels, restaurants, and bars, as well as arts and entertainment. That accounts for about 11% of Arizona jobs. So when you see a big disruption to an industry that's that big, and you think about how the spending of those workers kind of flows through the remainder of the economy, it's a big impact that will for sure generate slower growth and may generate a downturn here in the near term.
You just listed some industries that could be negatively affected. Is there a benefit to any industries as a result of all this?
Well, we may see some additional spending going to healthcare. Online retailers may see a bit of a benefit. We may see additional spending. In fact, I'm sure we'll see additional spending at grocery stores, pharmacies, that kind of thing, which will help to offset some of the spending losses that we'll see in other sectors. But overall, the growth that we see in those other sectors is likely not going to be enough to offset the losses that we'll see in travel and tourism.
How many months could it take to recover from an outbreak like this one?
I can tell you economically that if we fall into a recession, the thinking these days is that we will be looking at a U type of recovery, which means it will take us several quarters to get back to the previous level. It won't be a quick return to the economic output that we saw before the downturn began.
Okay, George, thank you.
Thank you.
Across the country, event organizers are canceling or making changes to limit crowd sizes. The cancellation of the Tucson Festival of Books this weekend marked the first major event in Tucson nixed over coronavirus concerns. It amounts to millions of dollars in lost revenue for businesses that count on the festival crowds. We asked Visit Tucson President Brent DeRad how the community can help minimize economic setbacks caused by cancellations. Something like Tucson Festival of Books, what's the economic impact of that sort of event?
You know, it's a lot of locals end up attending that. There's about 150,000 people, but it still has millions of dollars of economic impact on this region. The other great thing about the Tucson Festival of Books is that, again, it's one of the top book festivals in the United States, and it's something that's truly unique. Their ability to bring in top authors and to really make Tucson a focal point during our peak tourism season, it's just a great event, and we're excited about the future of that event.
How does this region recover from losing an event like that this time around?
I think at this point it really comes back to people hopefully being able to continue to live their daily lives.
What's your strategy given that there are so many unknowns right now?
I think the biggest thing is, and again, it's still early in the process for us and for cities throughout the United States. New information comes out every day and we're reacting. But at Visit Tucson, we're continuing to travel. This past weekend, again, there was a contingent of us and some of our members that went down to Hermosillo in Sonora, also to San Carlos, promoting this region, opening a new visitor center. We have meeting staff that they're out there at trade shows. We're bringing in meeting planners. To the extent possible, we're continuing to operate our business as we always have.
You had to have had conversations about continuing the course. What were some of the conversations that said we should continue to live as you said, as we've planned?
Well, it's one of those things too. We want to make sure, like with our staff, for example, no one's ever going to be forced to get on an airplane if they're uncomfortable doing so. We also want to just make sure that we're following all of the health and safety precautions that have been put forth by Pima County, State of Arizona, and certainly the Center for Disease Control. And so we're looking at all of that. We're just ensuring that we're looking at that information on a daily basis, trying to make decisions that, again, are in the best interest of our incoming customers and certainly of our staff as well.
The spring is typically a good time for travel to southern Arizona because of the weather, and then things slow down a bit in the summer. What's the plan moving forward now?
So I think the big thing for us, we're right in the heart of our peak tourism season, usually January through April. That's when we get the bulk of our visitors coming in. They're paying the highest rates at that point, seeing the most attractions, staying for the longest periods of time. We're going to do everything we can to continue to salvage this peak season. Everything we're seeing and hearing is that February was decent, but really right now in March, and what we're seeing especially on the meetings front, it's the next 90 days that appear to be really critical for us. us. Summer is summer. We'll certainly always market staycations in the summer, but one of the things that locals can do as well to help maybe augment what's happening out there, you have restaurants that are expecting visitors that maybe won't be coming now. Locals who can get out and patronize restaurants, get out to the different attractions, and really just enjoy your community. If you can get out and do that, that would, I think, really help take some of the sting out of the losses that we're going to see here over the next 90 days.
Well, the state's opioid epidemic resulted in more widespread use of fentanyl and heroin in Tucson that hasn't necessarily translated into more arrests for those caught with the drugs. In 2018, the department decided to try something new. Instead of taking people to jail, officers and behavioral health specialists talk them into treatment. In a return to our special reporting series, Arizona Addicted, we got a first-hand look at this approach.
He's with another male.
In two unmarked police cruisers,
Something in their life happened that led them down this path.
Arizona 360 hit the road with Tucson Police Department's Substance Use Resource Team, led by Sergeant Eric Ostropka.
It used to break my heart that, this was the only option, is to take this person to jail.
On our way to what the department considers a hotspot for drug-related activity.
So we're going to be heading over to a tunnel, like a drainage wash,
to see how officers implement the department's deflection program.
Sometimes it's a good place for us to meet some new faces and really get out the information about the program, as well as getting naloxone into more people's hands.
TPD enacted the program in the summer of 2018. It lets officers choose whether to arrest people in possession of certain narcotics, including heroin and meth, or refer them to treatment. The logic being that at a time when opioid-related overdoses were on the rise, sending people to jail didn't necessarily stop them from continuing to misuse drugs once they were free.
Would we be arresting people who had diabetes and telling them, just stop eating sugar? like that's kind of, I know that's kind of a real, might be hard for some people to understand, but it's not too far off.
However, only adults are eligible, as long as they're not wanted for a violent crime or domestic violence. Since the program began, officers have completed more than 1,100 deflections. That's according to researchers at the University of Arizona, tasked with evaluating the program's success.
Best case scenario is right away they go. They start their treatment, and then I hear from them a little while later saying, hey, you saved my life. The worst case scenario is they tell me they want it, they just don't want it today. And that is probably one of the hardest things to hear, is when they say, come back tomorrow. Because in my head, I know they're saying come back tomorrow because they want to go use one last time. It's very common, we get that. They won't tell me that they want to use one last time. And my fear is between now and tomorrow, they're going to overdose and die.
The substance use resource team we're riding with today come with special backup. A grant allows members of Kodak Health Recovery and Wellness to join officers in the field and share more information about the services offered by Kodak to help people overcome their addictions.
They're able to speak from a place of experience that I couldn't do, and that's really key.
That's true for Brendan Bond, who struggled with an addiction to heroin that resulted in a criminal rap sheet. After seeking treatment, he has remained sober for the last 5 years and hopes to help others do the same.
I can't tell you what would have happened, but if I would have gotten caught by one of these guys or shown where Kodak was early in my addiction, maybe I wouldn't have gone through all the stuff that I went through.
As our vehicles head toward the same destination, by chance, our paths diverge.
What's up, buddy?
What up, bro?
Black sweatshirt, you just took a 30-pack of beer.
A brief stop at a convenience store leads to a tip about an alleged shoplifter who took a case of beer.
And Cert 15, I'll be out my suspect.
Intercepted down the road, Officer Chris Sierravella and Travis Napier find drug paraphernalia on the man. With Kodak peer support specialist Bri Acuna, they explain his options.
You're not the first one that happens to.
Once he agrees, the handcuffs come off, and Officer Sierravella and Acuna continue on to Kodak, where they take him through a special entrance so the enrollment process can begin. On this day, he was the 4th person deflected here by officers.
Good luck to you. Okay.
We don't ever take each one for granted. We don't ever say like, oh, it's every day because, it's just another one. We realize that each person that goes is potentially another life being saved. It's another set of parents getting their child back. It's someone else getting their father or mother back.
This is probably, when we were talking about best case scenario, I think this was
Best case scenario.
This was best case scenario, yeah.
They say usually there's a lot of people in here.
At the tunnels, officers entered with flashlights.
Hello, Tucson Police, anybody home?
And quickly came upon a horde of items, makeshift rooms, and a man and woman.
Technically, you're trespassing, okay?
Okay.
That's not our primary concern today, okay? So as long as you're cool with me, I'm not planning on taking you to jail.
In the open air, peer support specialists and officers begin a similar dialogue as before, but this time with different results.
I'd just rather not waste my time or your guys' or his time.
I discussed the outcome with Officer Napier and Bond shortly after.
I've met him before, and basically the same thing happened. He listens, but he's just not ready to go, or he's scared to go, or he doesn't have confidence in himself. So that's why this time I just tried to encourage him and tell him that he can do it and try to share a little bit of my story, just so that next time maybe he's like, oh, this is the guy that believes in me, or whatever, you know?
Frustrating for you to know that you've seen this face before, you've had this speech?
Not really frustrating, just kind of makes me sad, just to see someone where I used to be and they don't have the confidence or the courage to better themselves right now. It's just building rapport, building relationship, and trying to encourage him for the next time, hopefully, you know? And then teach him harm reduction so that he stays alive for the next time.
Travis, we saw the no trespassing inside this tunnel. Why not arrest him?
I just think, what's the bigger issue here? I mean, sure, it is against the law, but as a police officer, I have discretion to make certain things, you know. If I cited him and arrested him, what would that do? Probably within a couple of weeks, he would have missed the court and he'd have a warrant. That's not fixing the underlying issue, which is his drug use. That's why he's homeless. That's why, if he's committing any property crimes, I want to try to fix that issue and then help him get into housing and, I guess, better him as a person.
You guys are experiencing situations like this every week. Do you ever worry that you're being a little too lenient because they're not coming around?
I don't think so. I think it's not a quick fix always like we want, and we have to build relationships with these people for them to trust us enough to go with us.
Despite not getting the answer they wanted today, the squad has hope that this approach remains better than the alternative.
A lot of bad stuff can happen, and we could have just stopped something bad from happening tonight. You know, when you're hopeless, you'll do crazy things. So hopefully we instilled some hope in these people, and it'll work out.
As part of Arizona Addicted, we want to hear from you. Tell us how you or your loved ones have been affected by the opioid epidemic, and let us know what questions remain unanswered. You can submit those responses anonymously on azpm.org/ArizonaAddicted, or leave a voicemail at 520-621-5999. Your responses will help inform a special episode of The Buzz on NPR 89.1, airing later in April. The 2020 census is nearly upon us. This year, people can respond online, by phone, or through the mail, but not everyone will. During the 2010 census, about a quarter of all households in Arizona failed to send back their forms. If history repeats itself in 2020, there could be as many as 1.8 million Arizonans that go uncounted, and the consequences would impact the entire state. That's according to University of Arizona researcher Jason Jurgovich, who helped us understand these so-called hard-to-count populations.
There's certain groups that are more likely to be undercounted or missed in the census, and so you've alluded to some of those before. Immigrants, non-citizens, children, the homeless, rural residents, and individuals of color. One of the challenges for Arizona is it's a fast-growing state, and it's also a very diverse state.
What is the census doing differently this year?
I think the biggest change that Arizonans need to know about is that this census is more digital than it's been in the past. It's relying on administrative data, sort of a 21st century census. And it's also the first time that the census will have an internet response, which will allow Arizona households to respond to their form by filling the form out online.
When there's a digital component, there's also fear that it may not be perfect as knocking on the door and seeing people or talking. How does the Census manage that this time around?
Well, fortunately, the Census Bureau has used the online response form with an annual survey called the American Community Survey. So they've been doing this for the past 5 to 7 years in the American Community Survey. Now, of course, one of the challenges this time will be that there will be roughly 325 million Americans, of which many of them will be responding online. And so ensuring that as people respond, the Bureau can handle those responses in terms of servers, ensuring that the data are private. That's a concern that a lot of Americans have expressed. And so they're doing a number of things, including working with the Department of Homeland Security to ensure that the data are in fact protected and private.
Remind our viewers that those who are skeptical of the privacy that they'll be involved in here with the census collecting is that there's a law that prohibits the government from misusing this information.
Correct. The law is Title 13, and it went into effect in the early 1950s. After census data were used to intern the Japanese Americans during World War II, turned over to the Department of Defense. After that, the federal government passed a law that said the Census Bureau cannot exchange any individual identifying information that the Bureau collects with other government agencies.
So the information is secure, yet people are still skeptical. How's the messaging going this time around?
I think that it's imperative that, one of the ways that Arizona is going to succeed, the U.S. is going to succeed, is that the Census Bureau has cultivated a number of partnerships, particularly with community-based organizations, to ensure that trusted community voices from individual communities are talking about why the census is important, why it's absolutely critical that you participate, and to address any particular questions.
And on that note, when you talk about resources, if you don't participate, 10 years down the line when we don't see funding, I guess we can't complain.
Ultimately, participation and being counted is about money and power. An average Arizonan brings in roughly $3,000 in federal funding per person per year to the state. That's determined by census numbers. Then, of course, political representation. Arizona is likely going to gain an additional congressional seat, so we'll have an additional House representative in the state, and that, of course, affects our electoral representation as well. And then I think maybe a less obvious sort of implication is that these data are used as the foundation for social science and policy research. And ultimately, we need to have a fair and accurate count to ensure that those policy prescriptions are fair and equitable, and that when we look at the outcomes of particular policies, that they are in fact equitable as well. And so if the numbers are not fair and accurate, that will hamper our ability to ensure that the policy is a good one.
This goes back to that thought that if you can participate, your voice will be heard. It's very simple.
Absolutely.
Okay, Jason, thank you.
Thank you.
That's all for now. Thanks for joining us. To get in touch, visit us on social media or send an email to Arizona360@azpm.org and let us know what you think. We'll see you next week.